Antimalarial drug as a COVID-19 treatment. According to New York Times, malaria drug helps virus patients improve in small study. The malaria drug hydroxychloroquine helped to speed the recovery of a small number of patients who were mildly ill from coronavirus, according to doctors in China. The hospital of Wuhan University reportedly a study where they gave the drug to 20 patients over 2 weeks, and all 20 patients had improvement in their symptoms within 2 days, and 19 out of 20 had less disease shown up in their CT scan of their lungs. With no proven treatment for the coronavirus, many hospitals have simply been giving hydroxychloroquine to patients, reasoning that it might help and probably will not hurt because it's relatively safe. Previous reports from China and France that the drug seemed to help patients have created a buzz around hydroxychloroquine and the closely related chloroquine, which are decades-old drugs used to treat malaria and autoimmune disease like lupus and rheumatoid arthritis. Another evidence that the lupus disease patients in China never suffered from COVID-19 because they are using the hydroxychloroquine medication as a treatment for lupus. Daniel K. Kim, the Hollywood actor, said that hydroxychloroquine is the secret weapon in his coronavirus recovery. In this chart, you will see the percentage of patients with COVID-19 decreased within 6 days after using the drug. Next video is an interview between Dr. Oz and Dr. Didier Raoult, who is one of the top infectious diseases in the world, and you will hear the opinion of 2 COVID-19 patients about the hydroxychloroquine and azithromycin.
Beat this. I spoke directly to the author of the French study about the drug combination everyone's talking about right now, hydroxychloroquine and azithromycin, which you all know as Z-Pak, the antibiotic. Could this combination help the world treat coronavirus? It's been all over the news, but I wanted to hear for myself. Does this famous specialist think we even need further studies? Take a look.
Are you optimistic that you'll show clinical benefit?
Oh, very, very optimistic.
If you personally had coronavirus, the COVID-19 virus, would you treat yourself with this combination therapy?
Of course, I've never did to my patients some things that I will have done for myself. Never. And I'm teaching that since I'm an old professor. I'm teaching that to all my students. each patient you should treat that if it was your mother or your son or your sister, because this is what is a doctor.
Wait a minute, I feel better, I can breathe. That was the biggest shock, because I'm like, the night before I was gasping. So when I could breathe, and then you start doing inventory of yourself, and I'm like, wait a minute, my fever's gone. And that's the first time in 9 days I didn't have a fever, and I haven't had one since. So to me, it was a great relief. And when I called the nurses station, and told them I felt fine.
Curious if there's any questions being raised in their mind.
It's my belief that this is being used on other patients.
Oh, well, then maybe you've already had an impact.
Antibiotics for pneumonia.
Were you surprised that these already existing drugs could be so beneficial? I mean, you're a nurse, you know the field a bit.
I wasn't surprised. I understand. I actually had some experience a few years back with a family member who was ill with some of the older medications were the more helpful medications.
Did you have any side effects, Margaret, from the pills?
Just a little bit of GI. Nothing that I can't tolerate. And my cheeks got really rosy once or twice, like bright red rosy. Other than that, I've been fine.
Margaret, thank you, and I hope you continue to feel better.
The U.S. Food and Drug Administration issued an emergency license to use hydroxychloroquine and chloroquine for the treatment of coronavirus due to its benefits in combating the disease. For more information, please click on the link.